Cool. So yeah, this is the Gender and Disability Responsive Social Protection Clinic, where we're going to be answering hopefully as many questions as possible, and also you will be as well sharing your knowledge and experience on this topic. This is co-hosted by the Social Protection Interagency Cooperation Board Gender Working Group, the joint programme on UNPRPD, ILO and UNICEF, and supported by SPACE, Social Protection Approaches to COVID-19 Expert Advice Service. The experts joining us today, who you will hear from and hopefully see very soon, Cinta, Abner, Alex, Meenakshi and Lara, all bringing a wealth of experience on disability inclusive social protection, gender responsive social protection, and kind of in a variety of specialisms within that. We're going to be using Slido, so I'm going to stop sharing the presentation for a second and give you the link to the Slido in the chat. And if, as the session goes on, feel free to kind of unmute and ask questions. But I think to get us started, if we can use the Slido function, we will be able to kind of gather a few questions, see what some of the most pressing issues, concerns, topic for conversation are, and start there. So I have, if I could use it, I've posted the link to the Slido in the chat that hopefully everyone can access. I will also share it from here.
Claire, this is a technical facilitator. I made our sign language expert on the spotlight, so I think.
Great, thank you. Yes, I should have mentioned we have sign language interpretation for this session. So hopefully you will be able to see her. Great, thank you. So if you're able to join us on the Slido page, the link I just sent, or as I say, if you want to ask questions in the chat or ask questions through kind of unmuting yourself, do feel free. But I thought we could spend the first 5 or so minutes of the session looking at the questions that we have on Slido. We will hand over to the experts to kick us off in some of these answers, and also kind of come out to hopefully have a dynamic conversation and sharing experience. We have a number of questions already on the Slido. So some interesting ones there. Given the additional cost of gender and disability sensitive programming, how do I justify this? If there's one piece of advice from a gender perspective, what would that be? Questions on targeting. Is targeting women and people with disabilities more effective than ensuring they're included in other programs? For all of these questions that are already there, if you would really like these to be answered, obviously we're not going to get through everything in a 1-hour session. Please do like them so we can see that those are popular questions. As I'm giving people a few minutes to maybe submit other questions that they might have or look through the questions that are already on the Slido, I will also share a link to the discussion document, the Google Docs, where throughout the day and throughout this session as well, we will be recording the questions, the answers, and enabling people to engage in the kind of the discussion, share experience, and where we will ultimately document the discussions that are had in these sessions as a live document that everyone can refer to in future. So I'm going to briefly stop sharing that so I can message. Oh, that's not. I'm just giving a few more minutes for asking questions before I hand over to our experts. That is the Google Docs there for people who want to go in. And obviously throughout the session, feel free to add more questions, to like other people's questions, and as I say, to come in speak, and as well as asking questions, really do share your experience. We've got you know, a number of people from different organizations, different countries, different experience in the room, and it would be great to hear from you as well about your experience and your challenges and the different opportunities in integrating gender and disability more meaningfully into social protection. So I guess in order to kick us off, will we start by answering some of these questions? I will bring in the experts that we have to start with, and I think, although he may not appreciate this so early in the morning, Alex, I was going to hand over to you on that. The first, I know you've done a lot of work on additional costs. Given the additional costs of gender and disability programming, how do you justify this to superiors and those holding the budget?
Thank you very much, Claire, and hello everybody. It's indeed a question that we get repeatedly, not only with regards to social protection, but broader service delivery in general. So from a disability perspective, I think it's really essential first to show the impact of not being disability sensitive in programming and the exclusion that it generates for persons with disabilities. That, I think, there is probably often an underestimation of how something that seems neutral is actually discriminating against persons with disabilities. So that, I think, really showing the impact is something that matters. Until recently, it was very difficult to do because we didn't have disaggregated data with both in terms of statistical data and administrative data related to social protection. The situation is changing step by step. We had also, and I think we still do, have a fairly low awareness on disability issues among social protection professionals, and which leads to a lack of consideration. So understanding better the impact of not being disability sensitive in terms of exclusion from social protection program is probably one first element I would push forward. The other element is also identifying what are those costs, and there are ways of prioritizing costs. And I think the importance of consulting with organizations of persons with disabilities and trying to find out with them what are the most cost-effective way of making program disability sensitive and disability inclusive. I will not lie to you, it is a cost. Of course, every time you want to include hard to reach public, when you have to remove barrier and you have to change the way people do things, it has a cost. It's true for disability, it's true for gender, it's true for different ethnic minority, etc., etc. At the end, so I think the discussion, I don't see any problem of trying to have a conversation with organizations of persons with disability on the cost effectiveness of measures. What are the measures that would be the most cost effective in ensuring inclusion? And how can we do the most with the resource we have? This is a very valid question. Another element which is really interesting is to see the impact of being disability sensitive. So we have talked about the impact of not being disability sensitive, but if you are disability sensitive, you will probably be more accessible to more people than just what we understand traditionally as persons with disabilities. If you work, for instance, on making procedure more streamlined, more simple, thinking of, for instance, people with cognitive impairment, you will also help a lot of people who have very limited literacy or financial literacy. If you work on making things more accessible from a physical standpoint, you will help many elderly people who would never qualify themselves as persons with disabilities, but who do have significant mobility issues. So I think first understanding better the cost of exclusion and the impact of excluding people with disabilities, working with organization of persons with disabilities to find the most cost-effective way of doing it, and then understanding better the benefits of being disability inclusive from a broader standpoint in terms of population reached. Thank you very much, Claire.
Thanks, Alex. If anyone else wants to come in to add to that, I think the point you just made there on the streamlining procedures and making them more accessible is really important from the gender perspective as well. And I think we're kind of seeing that discussed more in terms of COVID response, that you're making social protection programs more accessible for a wider range of people is great for all sorts of traditionally marginalized groups, but also just making sure that those programs are able to reach the people that they are intended to reach and reducing those sort of administrative barriers, I think is a really good point from the gender perspective. I think obviously we're not going to be able to go into depth in all of these questions. We will be continuing the discussion as the day goes on the Google Doc. So we'll add a bit more detail on all of these, but I'm mindful that we're getting quite a few questions and want to be able to get through some of those. So I was going to take the next one and ask Lara if you wanted to come in on if there was just one piece of advice you could give social protection actors from a gender perspective, what would that be? And the other way around, one piece of advice to gender actors from the social protection perspective. Thanks.
Yeah, sure. So I think I'm going to do them in the reverse. So I think my one piece of advice, and I'm going to try and be concise with my one piece, is that for gender actors, and the world I work in is typically working around gender-based violence. So I think the piece of advice I would give there is that I think cash and social protection arts are not something that we need to be afraid of. I think that they are tools in our toolbox and that we shouldn't see them as inherently risky. And that recent evidence that's emerging is really demonstrating that. I think in the reverse, the piece of advice I would give social protection actors is that gender does not mean women and girls, and that gender is a universal characteristic that if we ignore, we are doing everybody a disservice. So I think we need to get away from gender being something that is only specialized knowledge held by experts. I do realize the irony of me saying that, but I do think that this is something that we need to go beyond as an add-on, and it actually is something that is integral to the programming that we're doing in cash-based interventions.
Thanks, Lara. I think that's really great advice. Actually, if just going down the list for the next question, I might stay with you and also give you a chance to promote the great blog that you published yesterday on how can social protection be designed to have the best chance of preventing GBV?
Yeah, so we posted a blog today on the Gender and COVID Working Group. I think we can probably provide a link in the chat. And it essentially is a really distilled version of all the available guidance out there that we have now on preventing and responding to GBV through social protection programs. So obviously I encourage you to go there and share it widely. But I think that the way that we design our programs, I just mentioned it, but the emerging evidence is that we can actually prevent gender-based violence through social protection programming. Particularly where the evidence is showing that that's really strong is on intimate partner violence. And typically what that would look like is having a so-called cash plus intervention. So pairing a cash distribution with social norm change initiatives. Often this looks like working at a community level to change behaviors and attitudes around gender roles in the community and in the household, and also attitudes and behaviors around violence, and even just understanding what is and is not considered violence. Typically, these will be done in single or mixed gender groups, couples that, that's where the intimate partner violence evidence is emerging, is work with couples, but also community leaders, religious leaders, and other people who are influential in communities. And so if we design our cash programs to have this element, then they will be more effective at preventing gender-based violence. There's another element here, which is not specific to prevention, but it is around risk mitigation, which I just wanted to touch on, because I think that we have to go into every, and I should say here, my background is in the humanitarian side, so we have to go into every intervention with the assumption that we can also be exacerbating risk. And cash is no different. Cash is also not inherently more risky, again, based on the evidence that we've seen, but we do need to understand that there's always a risk that we could exacerbate risks of gender-based violence. And so by walking into a program design like that, with that attitude, is then we can start designing it so that it can identify the risks of gender-based violence and then mitigate them. Like I say, that's not specific to prevention, but I think it's also goes hand in hand with any cash-based intervention. I'm just going to run through a couple examples. I've just got them written down here, but simply having gender balanced staff, particularly frontline staff, can mitigate risks. Providing training to all cash intervention staff on gender roles, and gender-based violence is helpful, and also arming our cash program staff with information on available gender-based violence services in the community, or gender-based violence specialists and organizations that provide those services, so that if anybody does disclose violence to them, or they just have concerns as they're going through their work, that they know where to go for some additional help and support to work through any challenges that they feel in doing their work. And I'm not suggesting that our cash staff or social protection staff go out and identify cases of gender-based violence, but I do think giving them the resources that they know where to turn to if they have concerns is really useful. And then I think cash and social protection actors need to be working more closely with gender-based violence actors, so that they can monitor program delivery to identify any risks that emerge. I'm going to stop there because I feel like I'm going on a bit about risk mitigation when the question was about prevention, but I do think that those two go hand in hand, and I think that we now know more about how to design cash so that it can be most effective at preventing gender-based violence.
Great, thanks, Lara. Just want to pause for a second and see if any of the participants in the meeting want to come in with any of their sort of experience or additional responses on those questions that we've answered so far. The extra costs, advice across sectors, or GBV. If there's anyone else, I'm aware we've got a wealth of experience in the room before we go on with the next questions. Everyone should be able to unmute themselves, so I'll just pause for a second to see if anyone wants to come in. Oh, someone has raised a hand. Benji.
Hi there, good morning or good afternoon to everyone. Yeah, it's on Cash Plus. I feel like plus is a very big term, and I wonder what types of plus work best on GBV, but we've also seen kind of the idea of Cash Plus for kind of child nutrition as well. So what types of plus work best? And there's some suggestions sometimes that the cash is just to kind of offset some of the costs of participation in the plus. So in terms of the dosages, do you think a small amount of cash and a lot of plus is going to help more, or is a kind of very light amount of plus with maybe more cash more desirable? Is there any evidence on those types of things? Thanks a lot.
Thanks, Benji. I have a feeling that's a very difficult question to answer. I can come in on some work we're actually doing partly with Space on Cash Plus, but I'm wondering if any of the experts want to respond, particularly Lara, thinking on the kind of Cash Plus from the GBV side.
Yeah, I mean, I think I love the idea of what's better, more of one or the other, and what to get the balance right. I don't think we know, if I'm honest, but I do think that we are understanding the pathways of how cash is working. And so particularly around sort of increasing economic security in a household, increasing women's empowerment and influence on decision-making, and decreasing overall conflicts in a household. Again, this is all on intimate partner violence, and so it doesn't necessarily track across to other forms of gender-based violence. And one thing I'm really interested in, I don't have the answer to, but what's the threshold for that? And I've not read anything that says, well, after you have this threshold in this context of whatever it is, whether it's a percentage of average household income or I don't know what the measure would be, but when do those effects start to kick in? And so I think that that's an area we need to interrogate a little bit more, because the cash plus that I've seen that has been effective is sort of what I was describing before around having interventions run alongside cash, not necessarily conditional, but that are those sort of traditional social norm change initiatives working to unpack power, to unpack influence, to unpack gender roles, and also using that formula of looking at what your own values are, but also what you perceive your communities are. And that seems to be what triggers the change in behaviors, particularly assuming that others would find that behavior unacceptable and it's no longer held as a collective social norm. I know that's not really an answer to your question, but I think your question really draws out that this is an area we don't fully understand and really need to dig into a bit more in future research. And I'll hand over to Claire. She might have something more eloquent to say.
Thanks. Definitely not more eloquent. But just like, yes, the question really gets to this point that cash plus being seen as integral to delivering some of the more kind of gender or disability transformative interventions, emerging evidence, but really not enough to help us unpick, exactly the questions, what dosage, what can we do at scale. I think it's really difficult in most interventions to unpick the impact of the cash versus the plus, and obviously it's in combination, but the relative kind of cost effectiveness of different parts of any kind of package. There's a kind of growing number of cash plus pilots, and I think we're going to see more evidence on this in the coming years. Just to flag, we're about to do a quick kind of piece of work. And this is sort of FCDO and UNICEF looking across a broad portfolio of cash plus interventions, looking at evidence and practice to try and produce a bit more kind of a concise document on where we have evidence, where we don't, what that is showing, what kind of is looking promising for different, mainly gender equality outcomes. And we'll share that publicly when we have it in a few months. But I think it's an area that we definitely need much more sort of research and evidence in. Is there anyone else who wants to come in on those issues before we move on? As I say, please do feel free to kind of jump in, add to your experience, ask any questions if you want to kind of share more. But, okay, just mindful of time. I think we'll keep going, but as I say, come in at any point. I'm going to ask Abner now to answer a couple of these questions that I think are quite related. So, Abner, there's a question about what delivers better results. Essentially, kind of targeted programs, so whether that's gender or targeting people with disabilities, or making sure they are included in kind of broader programs. So, what are the different costs and benefits of different approaches to more inclusive targeting? And then I think a slightly related question on what is the best way to rapidly scale up social protection schemes to reach people with disabilities in a crisis. So Abner, can I hand over to you for those? Thanks.
Thank you, Claire. With regards to the question on what is the best way, whether mainstreaming or persons with disabilities in the social protection or not, I will say that both are needed because one social protection program does not protect anyone. Any individuals requires a combination of different schemes to better protect them from different risks that they might be facing, including shocks. So persons with disabilities, for example, needs also to have an income support for their income security. They need affordable health care because of the additional healthcare costs that they face, and as well as they need to be supported to access education and as well as work, particularly having personal assistance or other support services they might be requiring to ensure that they can participate in different socioeconomic lives. So there are many things that persons with disability require. So it cannot be solved by just merely mainstreaming, because mainstreaming is oftentimes focused on the general needs of the population, which is very important that we include persons with disabilities in the mainstream social protection. But then, even though, for example, people with disabilities are included in the mainstream social protection program, and this is what we have seen in the conditional cash transfer, when people, when families are not supported to make sure that their children goes to school because of the distance of the school from the home and the lack of transportation, the lack of caregiver to bring the child to the school and to stay to the school and provide support to the child because there is no carer services for children. Then what happened is that they will not uh, they will be delisted from the program for not complying with the conditionalities. So this is very, very important. And with regards to the how to scale up social protection schemes to reach people with disabilities during crisis, I will take Philippines as an example. So I would say that it is really difficult to scale up any social protection scheme without working with persons with disabilities and using all available local data for targeting persons with disabilities. So not all local government have a good database of persons with disability. So it is important to work with us with organizations of persons with disability to help identify the population of persons with disability. And then the major social protection provided during this crisis is the cash transfer for the whole population whose livelihood has been affected. And now in the Philippines, it's very easy to do cash transfer using the electronic method. And just having the mobile phone, you can register it with a specific service provider so that you don't have to leave the house. But you can also receive the amount just by receiving the text message, and then you go to the uh, uh, cash transfer outlet to withdraw the money. So there is very easy way to do that if we consider involvement of persons with disability on how to target persons with disability effectively. I think there are many examples, but I think the solution is always working with the target beneficiaries, so that we understand what are their current situation and how to address their needs based on what are available in their environment. Thank you.
Thanks, Abner. Can I just ask on the Philippines example? So, is that an example of where people with disability or DPOs were actively engaged in that response? And I suppose it's come back to the issue of the targeted or the mainstream approach. So was that in your eyes? Obviously, it's still very early days, but the response of the cash transfer for the whole population, was that an effective way of reaching people with disabilities?
Well, with regards to the cash transfer, uh, I think it is a very effective way because it's more flexible, so they can prioritize what are the important needs of their family that needs immediate response, in terms of expenditure. So maybe they can, instead of providing food packs, it's better to have a cash that is more flexible, whether what kind of food do you need to buy, because sometimes people with disabilities have food restriction. No, so this is more flexible than giving one type of food for the whole population. And then people may need maintenance medicine, for example, so they can adjust. It's more flexible. And the only problem in the Philippines is that only few local government have worked with organizations of persons with disabilities. So, and that's why I was saying that if only that the local and national government is working with persons with disabilities organization, they could have done a much better job, but unfortunately they did not. So that is the problem. I hope I answer.
Yeah, that was great. Thanks very much, Abner. I'm going to come to Meenakshi, who was going to add a little bit more on experience of the social protection and prevention of GBV. Meenakshi, over to you.
So when it comes to, I can talk from the lens of women with disabilities. What happens is that mostly, I can talk from the Indian case study, Indian example, where gender-based violence is mostly considered between intimate partners, whereas when it comes to persons with disabilities and women with disabilities, gender-based violence is also prevalent in their own families, which is not very much close to intimate partner violence or whatever, because of lack of income, because of the poverty basically existing within the families, and most probably women with disabilities are experiencing violence out of the whole situation. But the problem is there is no way of expressing it, because the law protects only the gender-based violence between intimate partners. So the systems that is designed for ensuring social protection when a person goes through violence, and towards the process of recovery and basically responding to the crisis situation is very limited. It's inaccessible for women with disabilities who experience violence otherwise from others in the family, not just the intimate partner violence. That is one thing. We don't have a space to go through. Then the systems of social protection that is existing in that particular situation, say for example the community shelter where the person wants to move out of the situation where they are going through violence, is not responsive to effectively include or access that space by women with disabilities. And there is no assistance in that compensates the disability additional cost in that situation where a woman wants to move out of the house, because the existing social protection do not take into account the gender aspect, and it is designed to as one size fits all. So many times what happens is that it is not enough, and women with disabilities do not have full control over the cash transfer or the social protection. And because of the cultural context, and also lack of priority on women with disabilities within a family, people do not want to incur that additional cost to ensure the person to access social protection benefits, because they do not want to lose the cost of accessing the social protection itself. Say for example, accessing disability certificate, one of the precondition for accessing social protection itself is being denied for women with disabilities. So, and also the system that redresses and supports recovery and ensure resilience in future, the whole process of rehabilitation and of after the experience of gender-based violence, that's completely inaccessible for women with disabilities, and they do not recognize violence otherwise than among intimate partners in our country. So I think this is also true in other contexts also. So we need to actually look at how inclusive the system of social protection when it comes to addressing gender-based violence, one, and also what should be the social protection or cash transfer and other services from the lens of women with disabilities, so that they can be, it is really responsive to address the experience of marginalization, gender and disability, the intersectional aspect of marginalization. I hope that answers. I was all over.
Thanks, Meenakshi. That was really interesting, and I think a really key point there on intersectionality and how services need to be able to respond to multiple forms of marginalization or violence or inequality. I'm just wondering, from the India experience, do you have any examples or any kind of insights into kind of good practice in terms of anything that has worked in overcoming some of those barriers or making services more accessible?
Actually, the services, the one of the good practices that that we have been following is the one of the committee recommendations on the Indian Penal Code, wherein when there is an abuse or violence generally on women, the redressal mechanism has to ensure accessibility. That's there in the guideline, or it's been the law has been amended to that effect. But when it comes to implementation, when there is a budget allocation, and if you follow the budget allocation for this particular redressal, we don't see the mandate on ensuring accessibility. And at the local level, the systems do not have facilities that allows a person with disability to access the services, the redressal mechanism. So the implementation has not taken into account the aspects of responsiveness towards women with disabilities in particular. So there is an amendment to the law, but not to the procedures, and it's not reflected in the implementation and in the conversion of the law into programs and schemes that will lead to redressal, effective redressal as far as India is concerned. And also the additional costs of a person with disability to access the system is not being taken into account within the particular system that addresses gender-based violence, basically. And also there are many laws. One is the gender violence and abuse that is on women with disabilities. That will be taken care of by the Indian Penal Code. The other one is the Domestic Violence Act, which is completely not recognizing the specific issues that women with disabilities face in terms of violence. And third is the Persons with Disabilities Act. Though it considers violence, abuse against persons with disabilities and establish a local mechanism to look into it, but it is not looked into the gender aspect, gender specific aspect, even among persons with disabilities redressal mechanism. So I'm not accepting for the laws that has recognized the whole issue. I'm not able to give good practices on ground, basically, and we need to have more studies on that.
Thanks very much, Meenakshi. That was really interesting, and hopefully you're kind of, as I said, following through from the legislative aspect into budget allocation. We would have some more good practice soon, or as you say, more research. Before I come to that, we've got more questions on the Slido that we'll go to in a second, but wanted to take the opportunity again just to pause if any of the participants on the call wanted to come in, again, share any experience or further evidence or insights into the questions that have been answered so far, or if you wanted to ask a question. Just going to pause for a second to see if anyone wants to come in. As I said, you can all unmute yourself if you want to come in, but I'll just pause for a second there.
Maybe if I could add a little bit on the question on scaling up.
Great, yes, please do.
Yeah, so I just want to share a little bit the findings we have from our recent study, a qualitative and quantitative study in Indonesia. We found that because in Indonesia, programs, the regular social protection programs had a lot of problems reaching people with disability because of the poverty targeting system and the difficulties with the database. And during COVID, when the government started implementing more local level programs, one in particular is the Village Fund cash transfer programs, where the national government for the first time allowed and require villages to allocate some of their development programs for cash transfers for people affected by the COVID-19 crisis. We found that this had affected significantly the coverage of people with disability because it allowed for community targeting. So at the village level, it's the point where you can see overall who's getting what social protection programs, and a lot of the villages put people with disability as one of the priorities, and we found that this has significantly improved coverage among people with disability in a relatively short amount of time. So maybe just as this is maybe specific to the Indonesian experience, but this is interesting when we look at national versus local or community targeting system. Thank you.
Thanks, Cinta. That's really interesting. Did you say that that's part of some research you're doing? Because I think it would be really great to see that and share, as you say, the issues of national versus local or community and different targeting mechanisms. Because I think we've had a few questions on that.
Yeah, so we did a quantitative study, which we have the report, the policy brief based on that. And we had a qualitative study following it up. And this is where we found a lot of the more detailed information from supply and demand of the social protection. That's still being written, but I'm happy to share the existing report from the quantitative study.
Great. Yeah, no, that would be excellent. I think there'd be a lot of interest in that, and thank you for sharing that, the experience from Indonesia. So again, mindful of time, I'll move on to the next question. I think, Alex, I'll come to you on one that we've had during the session, which is, do you know any good examples of how low-income countries identify and screen people with disabilities to assess eligibility for social protection in a rigorous, ethical, and cost-effective way? Thanks.
Thank you very much. This is indeed identification and screening of people with disabilities, probably the number one challenge that social protection are facing in regular time and in the expansion related to COVID-19. I think that one first element I would like to mention is when we say cost effective, it means that it's easily accessible everywhere in the country. And one of the key elements with regards to that is not to use medical certificate as a prerequisite, because as soon as you use medical certificate as prerequisite, you will restrict access and it will cost you a lot of money. So I have two examples in mind. The first one, so it's more low and middle income country. The first one is Dominican Republic, who has included the Washington Group set of questions, which is used to identify person with disability, or I would say rather identify household with person with disabilities. And there I really would like to insist on that. In different countries, there has been integration of such question within social protection surveys to build registry. And it's important to understand that this is really an approximation. This is basically trying to capture household where there is person with disabilities, but this does not equate an individual assessment and the individual identification of person with disability, which require a specific intervention. So Dominican Republic is an interesting example. We will have the presentation this afternoon in the roundtable. Then from an identification perspective, which is more in depth, I would like to mention Cambodia, Vietnam, and Fiji as interesting example, especially Fiji. We will have an intervention again this afternoon, where basically they use the social worker and the staff that are engaged in targeting or doing the targeting for the poverty benefits. They have trained them at local level to be able to carry out disability assessment and identification. And it has proved to be very effective. They achieved a coverage of 1% of, a bit more than 1% of the working age population in less than 18 months at a cost that was really, I think, really cost effective and I think ethical. It was done in partnership with organization of persons with disabilities. And it was, I think, it would pass the test of rigorousness. I think that there are other initiatives, like for instance in Laos, the ORCARD program, which is a community-based rehabilitation program. So it's broader as intervention than social protection, but they are using a digital tool which help community workers to actually identify persons with disabilities and the diverse set of needs with a tablet-based system that allow district supervision, skipping pattern, and I think with the use of technological tool and the development of fairly simple assessment tool, we are getting really close to the requirement you put forward. I would say it's fairly recent still, and it requires from government this idea that they can do that without focusing on the medical certificate as a preliminary requirement, but rather as a verification element. So that would be the first set of elements I can share with regards to that. Thank you.
Thanks, Alex. And I think that's a really good point to slightly pause and say we do have the gender roundtable and the disability roundtable this afternoon, where a number of these issues will be discussed at slightly more depth. And again, just to flag, I'll share the link again in the chat to the Google Doc, where we'll take all of these questions and document the answers, and also where possible link to the countries with really good practice and any documentation we have of that, so that people can go into more depth when the session is done, because I'm aware that we are quickly running out of time. And I'm going to go on to a couple of questions that I think are linked and ask Lara. So we've got a question which is, what factors would be most important in assessing whether a social protection policy is gender sensitive? And I think there's linked to that. Yes, where a government and its partners is interested in designing and implementing more gender sensitive social protection systems, what are the essential actions that are needed? And then just to bundle three at you at the same time, is there any guidance available to integrate gender into social protection and cash programming? So yeah, what do we mean by gender sensitive? What are the essential actions, and are there guidance? So over to you, Lara.
Sure.
Yes.
So I might start actually with the essential actions question, because I think, yeah, I think that's sort of a more logical place that I go to. I think, I mean, I don't know what you want to call basic actions, essential action, minimum standards, but I do think that, and I believe it was Alex earlier mentioned about the collection and use of disaggregated data. And I think, you know, earlier, Benjamin touched on some of the gaps in the evidence that we have, and the only way we're ever going to understand these things better is if we're collecting disaggregated data as a matter of course, because then at least we can go back on some of our interventions and investigate this in retrospect, even if we haven't designed studies. So yeah, collection and use of disaggregated data, age, sex or gender, and disability are the minimums. I think that's contextual. So whatever makes the most sense, in addition, if there are others, make sure that that happens as an essential action. I think I mentioned it earlier, but training for staff on gender and on gender-based violence. I think that they don't need to be experts, but again, I do think this is something that we need to consider a core competency through all sectors of programming, but particularly social protection and cash-based interventions. Because I think we have a lot of organizational cultural biases that we need to unpack and we need to interrogate. And I think that we can only really do that if, you know, maybe this is a bit pie in the sky thinking, but I do think that we need to challenge those things. And the only way we're going to do that is if we start talking about them in all sectors. I think essential actions would be conducting a gender analysis. So to understand what the situation is, what are the gender norms and roles in a context, and if there's been a crisis or a particular situation that we are responding to, how that has affected or shifted or changed any of those gender norms and gender roles. I would also encourage, as an essential action, a gender-based violence risk analysis. So at least understanding what existing data says about gender-based violence, prevalence rates, but also goes beyond that to sort of what are trends and patterns that have been seen, and then looking at where sort of the risks are that would be touched on during the implementation of a program. And then I think as an essential action, bringing in expertise. And so whether that's having somebody sit in-house in a government ministry or department, whether that's accessing a drawdown service like SPACE, or having a consultant on a certain number of contracted days or on standby that can come in and provide on-the-job training and mentorship and capacity building, but not just in a formalized training environment, but actually doing some work to problem solve as problems emerge in a program. So those are the essential actions. If I go to thinking about the policy side of things, then I guess that I would expect a good policy to articulate those. Knowing that good policy is also short and concise, I don't think we can go into such great detail. But I mean, one of my first questions, if I was analyzing a policy, is does it mention gender? I would go beyond that, and I would look at whether or not it mentions age, whether or not it mentions disability, whether or not it mentions vulnerability, and how vulnerability in that situation is defined. I would expect it to recognize the policy I'm speaking of here. I would expect it to recognize that gender inequality exists and that any situation that you're responding to is likely to exacerbate those inequalities. And then again, I would expect it to specifically reference the necessity of doing gender analyses and particularly just recognizing the unique differences and challenges that different genders that they face. And also I would expect it to look at social inclusion as well, as I mentioned. And then all of this, I would insist upon that it have a commitment to act. So not just be a policy that, suggests all these things are nice to have, but actually will be acted on. So that was my first two questions. What was my third question? It was on, I'm looking at the Slido here. Can you remind me, Claire? Oh,
yes, sorry, I was going to say I'm also aware that I am under strict instructions to not let the session run over.
Okay.
So just on the guidance. Yeah.
I think that there's a lot of guidance out there. I think actually we have we're in a really privileged position right now that we have guidance we can use from the humanitarian sector that has been developed on how to integrate gender-based violence into cash and voucher-based programming. I just want to flag, and I'll put these in the chat and on the Google Doc, but that UNICEF has a technical note out on gender responsive social protection specifically during COVID, which we have. And CARE has issued 2 good pieces of guidance, one specifically for humanitarian action, but then one for non-humanitarian action for non-GBV specialists on how they can integrate GBV measures or just integrate GBV into the program design and implementation. And then I guess is a really great place to start, almost like I designed it. We also have the blog post that Amber Peterman and I had drafted where we tried to take out the crunchiest bits of all of this guidance and put it in there. So you've got the link in the chat.
Great, thank you so much. And as I said, in the Google Docs, we will kind of make sure all of those links to guidance are signposted. Valentina Barker and with the Space Service have also just put out their updated kind of COVID resource pack, which has links to so much great guidance, including on disability, on gender, on other sort of areas of intersectionality and on vulnerability analysis. So we'll share that as well. I realise we've only got a few minutes left and people are rushing off to other sessions. So firstly, just to say a huge thank you to everyone for participating today. We haven't been able to answer all the questions as we didn't expect to be able to. There is another live clinic session this afternoon. I'm not going to try and do all of the different time zones. I think it's in about 10 hours. I need to double check, but it's on the schedule. There also, just to flag, we have the gender roundtable and the disability roundtable both coming up later on today. So please join if you can. A huge thank you to all of our experts who have shared their experience and the available evidence and practice. We will fill all of this in on the Google Doc. We will add to it. Please also add to it and share it with your colleagues. It'll be really great to start learning from your experience as well as what we have on the panel here. But just, yes, thank you to everyone. I've got up on the screen there some sessions that are coming up later on. We've got more clinics throughout the day. There's, as I say, other roundtables, self-protection as well, and some virtual booths. So thank you to everyone and enjoy the rest of the day.
Thank you very much, Claire McCrum and Susan Emerson for translating. And if you can fill out our little survey, it's in the chat. Maybe I put it one more time. And otherwise, we wish you a nice day. So one more time in the chat, if you have time, we appreciate it. So Claire and all the experts, Susan, have a good day. And I will close this meeting room in 1 minute. So Claire, if you want to say anything else, you have 1 minute.
No, just to reiterate, please do add more questions to the Slido. If you want to, we will continue to monitor that and answer them throughout the day. Check out the Google Docs. We'll share some more links to guidance. And just thank you, everyone. And yeah, have a good rest of the day. Bye.
Yeah, you too, Claire. Okay, bye-bye, everybody. I close the room. Stop.